you tear it, it keeps getting worse and worse because your body keeps adding more nerves, and more nerves equals
More pain.
more pain. And then the other problem with these nerves is that they're special nerves. They fire faster and more often than regular nerves. They're what we call hypersensitive nerves. Guess what that means?
Easier to, and you're more sensitive. I mean,
Yeah, and that's why you were mentioning that even when your back isn't hurting, there's a little achiness there all the time. And it's achy in the morning when you get up. And this is true of any injury that you have because it has more nerves and they're hypersensitive. People who've torn their knee or hurt their elbow, it tends to ache over the years more and more as it decays.
yeah.
Any questions about this? All right. So these are the 4 problems that we have to deal with. And let me explain now how we're going to fix them for you, okay? So the first thing that we're going to do, and what we already did, is we do adjustments. And what an adjustment is that's when, remember when I twisted you into a pretzel and yanked really hard? It wasn't really hard, but I still stretched your back.
Yeah.
And what that does is I'm pulling in a very diagonal, it feels like a pretzel, and I'm twisting it and I'm yanking on the fibers. And when I do that, that quick jerk actually untangles some of this scar tissue. So that quick motion after the adjustment, I pulled, the fibers were like this, and I yanked on them and I made them straighter. And so that's why when you got off the table, the fibers looked like this, and you went, hey, I feel a little better. I feel looser because I straightened out the fibers. And the adjustment's gentle enough that it doesn't tear the fibers. And that's the trick. Now, they don't look that pretty, but they improved. And that's where you get all the benefit. If those fibers are straighter, guess what that's going to do to the strength?
If they're straighter, then that would be good then, right?
Yeah, exactly. They're going to be, exactly. They're going to be stronger and they're still tangled, but yeah. And then the other thing, is that going to help with flexibility or not?
I think it would. If they're getting stronger, they'd be getting more flexible, right? Or
Yep. And the straighter they line up, because when they're like this, they start popping one at a time and they're stiffer. So that definitely helps with flexibility.
Is that when traction comes in too? Like, does that help with?
Traction is going to help a ton. We're going to talk about that in just a second. Do you think it helps with the nerves?
I'm not sure about the nerves.
It doesn't. There's still a lot of nerves there.
Because if it's still the type 3, would it still have a lot of nerves?
It does. And your body will actually try and reabsorb some of the nerves and get rid of them unless you maintain your inflammation. So if as long as there's inflammation, it keeps the nerves there. But if we can get rid of all the inflammation and strengthen this joint a lot, the body will actually get rid of some of the nerves. It doesn't want them there. In a normal healing process, it gets rid of a bunch of them. But if you don't heal it completely like you haven't, then it keeps adding them there.
Okay.
And they get less sensitive because they're not tangled up in the scar tissue as much if we can organize the area a little bit better. So that's all we have to do is straighten out all those fibers. Now I mentioned the adjustment is the easiest and safest way, but the most aggressive way. The adjustment, the downside of the adjustment is it's too gentle. It doesn't pull hard enough or long enough. We like it because it's so safe. We can do it in the inflammatory phase and during the repair phase, but it's just not aggressive enough. The more we stimulate it, the better. So the most aggressive way to stimulate scar tissue is with a hard, slow stretch. So an adjustment is a fast, gentle stretch. We actually want the opposite of that. We want a hard, super hard pull for as long as we can do it. 15 minutes is the goal. So that's what traction is, and you already got that. And it's the best way to do it. But we have to be careful with the traction, because if we do it too hard, guess what happens? It tears, and we get pain again. Exactly right. And that's what we don't want. So my goal is to get rid of the inflammation with the adjustments by Wednesday, and then we'll try the traction, but we're going to do it super gentle, very carefully. And then as you get used to it, the goal is to do it as hard as we possibly can.
Okay.
But never enough to hurt you.
Yeah.
But if we don't do it hard enough, you don't heal. Make sense? So it's a balancing act, and we got to play this little game, and we're going to have to communicate really well to make sure we do that, because I've only got 10 weeks. And if we don't get anything we do during the 10 weeks is going to make all the difference long term. And that's kind of why you've been stuck in this situation, because you injured your back, you did some exercises, but not any traction, not any adjustments. So it didn't heal very good. And we got to undo some of that bad healing and try and heal it right this time to prevent future problems.
Okay.
Any questions about that?
No. Right.
How are we going to know at the end if we did a good job or not?
I would say if there's more strength and flexibility, probably reviewing the x-rays to see where we're at, but my range of motion should be increased.
Exactly.
Sure.
Remember the exam we did yesterday and we found all these problems? We should be able to do that same re-exam and it should show us that, yes, I am more flexible. It is stronger. Remember how I would bend you sideways and push and you'd be like, ow, that hurts. Shouldn't hurt if we did a good job.
Yeah.
Now yours won't heal 100%. These things never do, but we can double or triple or quadruple the strength and you should feel that. Not just in your symptoms. Your symptoms should get better or go away completely. I don't know how well you're going to heal yet, but we're going to measure you along the way and make sure that all we're getting the strength and flexibility back. And of course, some of the nerves should go away, but they'll be less sensitive too. Okay?
Okay.
Any other questions about this?
No.
All right. Very good. Thanks, Brianna. Let's go over day 2 and break this into, do you have the breakdown already, Chris?
Yeah, I have the Word document right in front of me.
And Chris, I'm gonna send you I know I already sent it to you, but just in case there's an updated version.
Do we have one for him, his day 2?
Yeah.
All right. What
I'll pull it up for you right now too.
All right. So let's go through. Yeah, I don't have yours memorized quite as off the top of my head.
That's okay.
Let's go
It's
through
pretty
his.
much the same thing.
So the first thing you're going to do is,
Introduce myself.
well, this is day 2.
Oh, day 2. I'm going to ask how they're doing.
Yes. Are they sore? And obviously you probably didn't do a treatment. If you did do a treatment, how was your response?
Right,
And-
like so cold laser.
Yeah. And remember, you always warn them, hey, listen, but the last thing you say before they leave on day 1, listen, I was super careful with my exam, but just the exam itself could make you sore, or the cold laser won't, but I just, you warn them. I hope I didn't make you sore from the exam, but if I did, it's no big deal. We didn't re-injure anything.
Right.
And when they come in, you say, were you sore at all? Because of course, 1 out of 20 will get sore or have a flare up, either because of your exam or just randomly and you don't want to get blamed for that. So if you warn them in advance, on the off chance they get sore, when they come in, they'll say, you were right, doctor. I was really sore after your exam. And they won't be upset with you.
Right.
So when they come in, they say, yeah, I was sore. Actually, I was miserable the rest of the night. Say, I apologize, but we knew there was a chance that was going to happen. And they'll usually say, yep, you were right. So,
which leads right into, were you able to use the ice pack?
I don't know that I mean, you can ask that. There's nothing wrong with that. I don't really care whether they did or they didn't. And the reason is, well, I mean, if they didn't, so what? If they did, so what? If it helped or if it didn't help isn't hugely relevant. So if you want to ask that, you can, but I don't see there's no, everything we do, there's a purpose behind it. And
That has no purpose.
well, if they did, are you going to change anything you do or say?
No, I would just encourage them perhaps to keep doing it. If it didn't help, I would say, well, then don't waste your time. If that makes sense.
Right. So if they did it, and even if they didn't do it, now they feel guilty and they apologize, which isn't a feeling I want to encourage. And so if it was me, I guess I don't see oh, you didn't do it, you stupid moron. Now they feel stupid. And if they did do it and it might have helped or it didn't help, it's up to you though. And again, I want efficiency, but it's a tiny, tiny, tiny thing, no big deal. So the next question is going to be, or the next point,
I guess, is the confirmation of diagnosis, right? So I got a chance to review your ultrasound.
Yep.
It looks like you have what's called a biceps tendinopathy, let's say, which means, what that really means is you have some inflammation in your biceps tendon.
Okay, now I'm gonna stop you real quick. You made a big mistake right there. I don't like what you just said.
Okay.
Did you catch it, Colton?
Mhm.
What did he do wrong?
You went into explaining the diagnosis and didn't ask if the patient knew. You want them to tell you their understanding first.
That's correct, but actually that's not the one I heard.
Oh.
What I don't like is you said, I'm pretty sure. In other words, the worst thing you can do is be wishy-washy at this point. Even if you're only 70% confident, you would say, if at all possible, I would say you definitely have a torn biceps tendon. This breeds confidence. Don't be wishy-washy. I think maybe sort of there's a possibility that you might, by chance, have a torn biceps tendon. That does not inspire confidence. As opposed to, and this is, remember, this is strong, confident, body language. You definitely have a torn biceps tendon, Chris. Okay? They're looking to you for leadership and guidance. And you're worried about, misleading them or over pushing who you are and what you are as a doctor. Look, I think you're a naturally humble guy. I think you're very smart, very talented, and you're never going to toot your own horn. And I think that natural, humble quality about you is awesome, but it's going to hurt you in this situation where this patient's looking to you for leadership, and you have to step up and say, essentially look them in the eye and go, hey, I'm on this. I know what I'm doing, and I'm going to help you.
Right.
Even if it's just ruling out, I'm going to help you. We're going to do all this, and if it doesn't work, at least it doesn't work, and you can move on to something else. What they don't need is a wishy-washy doctor who's halfway certain, you see.
Sure.
Now, let's say you really genuinely don't know. It's absolutely okay to say, I'm 70% certain this is the problem. I don't recommend it if that's your only option. So sometimes I'll have somebody with an arthritic hip and a bulging disc in their lower back, and I'm not sure which one's causing the butt pain or the radiating pain to the knee.
Right.
In that situation where you have multiple problems, which is common, you're going to get, and what if they're overweight? And what if they also have fibromyalgia? I mean, you're going to get we're sending these cases to you. Okay? And so that's the common one. So if there's only one option and you're still only 80 or 90% certain, you still want to just look them in the eye and go, hey, this is what you've got. And then later on, if you have to, 1 out of 10 times go, you know what? I was wrong with the diagnosis, but at least we ruled it out, and that got us to the correct diagnosis.